So what is the difference between gynecomastia and just having a fat pocket in your chest? Patients typically describe a firm, rubbery feeling behind their areola, and sometimes it expands beyond the area of the areola to create what looks like man boobs. Regular fat is usually soft and squishy, whereas dense breast tissue is really firm and rubbery. Liposuction can sometimes suck out the fat, but it often doesn't take away that dense, firm breast tissue. True gynecomastia is dense glandular breast tissue and will not be able to be removed unless you physically cut it out with surgery. So how common is gynecomastia? About half of the male population will develop gynecomastia at some point in their life. Sometimes it can develop during puberty, during rapid hormonal growth. However, sometimes that involutes over time. After adolescence or puberty, if the dense breast tissue still persists, then that might be true gynecomastia. So what causes gynecomastia? There's a whole host of causes of gynecomastia. Most commonly, it's idiopathic or just random, and we don't really know why. Other reasons include hormonal changes. Other examples of causes are drug-related or medication-related. For example, anabolic steroids is a common reason for developing gynecomastia. Similarly, marijuana use is and has been proven to show an increase in gynecomastia. Other prescription medications like diuretics, beta blockers, among many, many other prescription drugs can also be a cause of gynecomastia. Another reason of gynecomastia could be a tumor of some sort, whether it's male breast cancer or a testicular tumor that's increasing your hormones. That could be also a cause of gynecomastia or abnormal male breast growth. So what are the signs and symptoms of gynecomastia? Well, most obviously, patients have a lot of growth or breast tissue behind their areola in their lower chest area. This is often considered or described as puffy nipples or puffy areolas. Oftentimes, patients feel embarrassed to take off their shirt, typically whether they're at the beach or wherever the case may be. And oftentimes, if it's a little bit more advanced, that growth or extra breast tissue can be seen through a t-shirt, which is one of the most common symptoms or one of the most common things patients tell me when they come see me in my office. So how is gynecomastia diagnosed? Well, for gynecomastia, since there's so many different reasons that can cause it, getting a comprehensive history is critical. We need to know if you're on any medications. Are you using any recreational drugs like marijuana? Are you taking anabolic steroids at the gym? Or are you on testosterone for hormone replacement therapy? Or are you on any medication that may cause this? Similarly, you might have a condition where you have increased hormones. Is it because you have a tumor in your breast? Is it because you have a tumor in your testicular area or elsewhere that's causing a rise or a surge of hormones that's causing the abnormal breast? We need to know. And we know that by getting a lot of labs. And the labs will help determine if your hormones are in a normal level or not. We also do a physical examination to see how much breast tissue you have. Where does it span? Is it really breast tissue or is it fat or is it an element of both? This not only helps the diagnosis of gynecomastia, but it also helps the treatment plan and guide you through the different surgical options that you may be a candidate for. Imaging might be indicated depending on your risk factors. For example, if you have a very strong family history of breast cancer, whether it's men or women, you might need to get a mammography to see if there's any abnormal breast tissue that is concerning for cancer. An ultrasound might be also useful to determine the extent and characteristics of your breast tissue to see how dense it is, if there's any cysts in there, or any other concerning features that might guide your treatment plan. So what are the treatments? For mild gynecomastia without significant breast tissue, liposuction alone might be sufficient. However, oftentimes that's not usually the case. Typically, there's a dense or firm glandular tissue behind the areola that's really hard to get out with liposuction. Even using ultrasound, even using laser, and even using the most up-to-date cutting-edge technology, that dense breast tissue is really hard to break up and even harder to suck out. For patients that have that, you might need something called a direct glandular excision, where we make an incision around the areola and directly cut out that firm rubbery tissue that wouldn't otherwise be taken out with liposuction. For patients that have a lot of breast tissue and a lot of extra skin, meaning folding skin or rolls, you might need a little bit more surgery where we cut out an extra amount of skin so that your chest contour will be restored. For the most extreme, patients that have not only a lot of breast tissue but a lot of extra skin and may have lost weight, you might need something called a free nipple graft, where we cut the nipple off and the areola and we paste it back on as a skin graft. These patients are usually the most extreme, and again, it depends on how much extra skin they have and how much contour they want to have improved. Everything is a spectrum. Liposuction alone may not be sufficient, and adding scars on your chest might not be what you want, so you might be somewhere in between with a direct glandular excision. It all depends on the extent of scarring that you want and the contour that you want to have. So one question I get all the time is, does insurance cover gynecomastia surgery? Usually not, but it depends on a few things. If you have a family history of breast cancer or a strong personal history of cancer, you might have insurance cover your surgery. Again, it depends on your policy and every insurance company is different, but some of the things that it depends on is the duration of symptoms, the severity of symptoms, if you have any cancer risk factors, and if you have any abnormal findings on ultrasound or on mammography. Those are all important features that may influence insurance to cover your surgery. What is recovery after surgery? Well, it kind of depends on which surgery you have. For liposuction, it's usually very straightforward. Recovery is merely just a few days, at most a week, and you can return to work by a week. If you have a direct glandular excision, it's a little bit more surgery, but still it's nothing too significant. Most importantly, do not lift anything heavy for 2 to 4 weeks, and you can probably return to work by about 1 week. The pain is not as much as liposuction, it's just a little bit more soreness. And depending on how much breast tissue you have, you may or may not have a drain after surgery. For bigger surgeries where there's skin that's being excised, you probably will have a drain. Your soreness might be about a week. And again, no heavy lifting for about 2 to 4 weeks. You can start light activities at 2 weeks, but definitely no heavy activities at 4 weeks for a larger excisional surgery. And most likely you will have a drain for that surgery. One question I get a lot is, if you do have surgery for gynecomastia, will it come back? It really shouldn't come back. If you're removing the dense breast tissue, then it won't come back unless the underlying cause is still there. For example, if you have gynecomastia surgery and then you continue to use marijuana, you continue to use anabolic steroids, or you're still on the prescription medications that caused it in the first place, there is a chance that your gynecomastia can recur, and there is a chance that your breast might look good for a little bit, but it might start to grow over time. That's why before having any surgery, it's important to diagnose the cause of gynecomastia and to try to stop or remove the offending agent, so to speak, so that it doesn't come back should you have any treatments in the future. So in summary, gynecomastia is a real medical condition that affects men with abnormal breast tissue in the chest area. It is different than just having abnormal fat pockets in the chest because it's dense breast tissue. Sometimes patients are at risk for breast cancer because of a strong family history or even a strong personal history of cancer. That's why getting a mammography or an ultrasound is important. Working up to see what causes the gynecomastia is also important to prevent recurrence in the future, and it's also important to help guide treatment should you desire to go forward with surgery. If you have any questions or not sure if you're a candidate for gynecomastia surgery, call our office and I'd love to see you.